Are meal times a serious struggle? Does your child eat a limited number of foods? Does your child eliminate entire food groups? Are you tired of waiting for them to just grow out of it? Welcome to How to Unpicky Your Picky Eater, where you'll learn strategies to help your picky eater expand their palate. With Christine Marotti-Yoder, a pediatric feeding specialist, speech pathologist, mom of a child with feeding issues, and author of Mealtime Mindset. Let's get started. Here's Christine.
So thanks everyone for joining us. I have Amanda Foreman here. I said your name correctly, right?
Yes.
Okay. From Real You Nutrition. And she has very interesting areas that she works with. She works in, I'll let her introduce herself. But, since I had her on since it is breastfeeding month. And really a big part of feeding starts when you're born and that first connection that you have to food. So this month in general, I'm interviewing all people that have to do with breastfeeding and just all of the things that go along with it, the relationships and the challenges that can come about as well. So welcome, Amanda. Thank you so much for joining us.
Oh, thank you so much for having me.
Yeah, so tell everyone exactly what you do and who you like to, really work with and help.
Sure. So I'm a registered dietitian and I'm a women's health and hormone specialist. And I also do a lot of work with gut health. And I take a more integrative functional medicine approach as it relates to nutrition. So I also integrate hormone testing and gut testing into my practice and different like herbs, nutraceuticals, and supplements, pending symptoms and what we find alongside, of course, nutrition, lifestyle, mind, body, sleep, stress, all of this stuff connects. I'm kind of more look at the whole picture and look at the whole woman. And I love what I do. So I'm super happy. And I do work with a lot of women in all the perinatal stages. So especially postpartum is one of the main ones as well. So, and there's a lot going on in the body postpartum for sure.
So much. I mean, I feel like sometimes the moms get forgotten about. It's like the baby comes out and it's like all about the baby. And it's like, wait a second, we just did like a whole big thing. And I feel like we don't seem to like get any support after. And there is so much that goes on. And that expectation that you're gonna like have this whole breastfeeding relationship and there's like almost no support if like what if it's not going right or there's so much I feel like in that fourth trimester that happens that's so important
Yes.
for mom and baby.
Yeah, no, absolutely. There's just, I tell everybody too, there's just so emotionally, like mentally, hormonally, like your identity. There's just so many like pieces of this that, are just also so new and so different and they change in an instant. So, it's a lot of moving parts.
That's very, very true. And yeah, it's like layers almost of like, and sometimes like you might like fix one thing, but like another issue might pop up behind it, right?
Yeah,
Yeah.
absolutely.
So, the gut health, do you find that there's like a connection between the mom's gut health and the baby's? Because I remember like when I was my doula teaching me when I was pregnant that the baby in the breast milk, it kind of plays off of your own gut health. And like
Mhm.
they're actually like what's in your digestive tract, what immunities you have is literally like just passed through the milk to them. And I don't even know if people realize that because I was kind of surprised when I first learned about it. But basically, like your body will make even like whatever they need at the time. So it's just like a constantly changing thing. But do you find that there's a lot of gut health issues that the moms have that then affects the babies as well?
Yeah, definitely. And, good, maternal health, even prior to conception, one of the pillars of that is good gut health. When we have what we call like dysbiosis, so meaning like there's some sort of issue in the gut. Maybe it could be overgrowth or undergrowth of certain bacteria or inflammation or different things like that. It affects the way we also digest and absorb nutrients. So if our digestion is affected, even at that baseline, prior to getting pregnant, during the pregnancy, and even postpartum, maybe mom's not absorbing enough of her vitamins, not enough is getting past the baby, different things like that. And it affects, kind of everything affects each other. So, yeah, absolutely. And if the mom has like a really good, good healthy microbiome, good gut health, gets plenty of fiber and things like that, the baby is, again, there's that direct line from the mom to baby. So baby is getting all of that too. And a lot has come around too with like prenatal probiotics, good quality probiotics too, to make sure that that's happening and helping it along.
Yeah, I wish like these were all things that I knew before I had a baby, like I only about everything after, of course, right? But
Me too, I know.
but what you're saying is, I think, so true. And I don't know, I can't like verify as like this as a fact, but what had happened to me, part of my story, was I had a miscarriage before I had my son, and there was no explanation for it, right? I was already eating like organic, so I was like pretty surprised. I was pretty, relaxed, not stressed. And when they sent it to the lab, they were like, oh, it's probably like a chromosomal. This happens all the time. It's very common. But nothing came back. There was no chromosome issue. There was no, couldn't give me a reason for it. And I did my own research, and I had found that gluten could cause inflammation, which can also, if you are sensitive to it, can block the baby from getting nutrients. And I was like, oh my gosh, well, maybe that's maybe what happened. So I cut out gluten and like de-inflamed my gut. And then I went on to have, a successful pregnancy after that. But so I can't like say, it was because I gave up gluten or whatever. But in my mind, that was always something I thought about, of like that connection between the gut and even just being able to carry a baby successfully. I don't know. Do you work with moms who are also struggling to get pregnant? Is that something that's ever come up? Or
Yeah, that's actually really interesting that you say that. So, yeah, I do work with a lot of moms who are struggling to conceive or who are going through fertility treatments actively. And, one of the main things that I always tell them rather, is like your body also, your brain needs to know that your body is safe in order to be able to have the child, right? Your body needs to be a safe place. So there's so many things that can trigger that kind of will send signals that your body maybe is not a safe place, right? Like stress. Stress causes inflammation. Stress causes your cortisol, your stress hormone, to go up and progesterone to go down. You need progesterone for a healthy pregnancy. There's also some thought of, regarding that with miscarriages and difficulty with conception as well. And again, gluten, it depends on who you are, right? If you have sensitivity to gluten, I actually check for that in the gut testing that I do, and your immune system markers and things like that. But yeah, if that was a source of inflammation for maybe you personally, like, yes, then that could have affected it. Is it gluten for everybody? Probably not, but for you, gluten was causing inflammation and causing stress.
Well, it turns out when I did gut testing that I was sensitive to gluten, but I never knew that beforehand.
Right.
But that's what made me think of it, because that was just something that, sometimes when you're like researching and something just like almost like you like feel it as truth, like within you, you're like, oh my God, wait, this connects, like something about this resonates more than other things. Like you can read a million things and some of them they just didn't sound or feel right. And that one just like clicked for me. And then once I had the testing that confirmed it, I was like, oh my gosh, like so huge, right? Just knowing that.
Totally, absolutely. Yeah. And that's the thing, is there's so many things. And like step one too, like is making your body a safe space. And like it starts with all those things: stress management, decreasing inflammation, and all of those things also tie so much into gut health and hormone health and mind body. So if you like, it's all like intertwined and interconnected in so many ways.
So true. I know it's really hard to separate out all of it. Like it's impossible, right? I'm sure.
Hard.
And yeah, gut, I mean, baby's gut is so important too. Like when they come out and, the transition from just being in the womb and the umbilical cord to like now having to process food, right? And being a mom
Yes.
going through that. That's such like a crazy transition, I'm sure, for them. But yeah, that's so cool though. I love that everything does kind of work together. I guess it makes it harder in some ways, but it is kind of amazing just how the body it's just all the systems just seamlessly work together.
They do. They really, really do. And sometimes it's something like, something could be off in somewhere and that triggers something else. There's so many like what we call like cofactors and different, whether it's vitamins, nutrients, enzymes that we have in our body that are helping things happen, to put it in a more like simple matter. And if there's even some kind of small thing off sometimes, it can cause something you wouldn't even think. And like sometimes, I always kind of am thinking with unexplained, even infertility, like I don't always buy that. I'm like, I think there's always eventually some kind of explanation. It's just very difficult sometimes to find, because there's so many little things.
Right. But you're like the detective that was teasing things apart, right?
That's me. I'm the detective.
And now, so how do you then optimize, I guess, mom's nutrition so that, because like if mom's not eating well, then that means that baby also isn't eating well, and they're not getting what they need. So like, how do you help moms kind of, or is there like a go-to, or everyone must be like a little individualized? Like, how do you do that?
Yeah. So do you mean more like specifically during pregnancy or postpartum or prior to conception or kind of the whole thing?
I don't know. I guess either. I was thinking afterwards, but but there's value in both. So, whatever you want to talk about.
For sure. So, obviously it's important again, and I'll briefly touch on it, preconception nutrition, at least like 3 to 6 months prior to, in terms of when you eventually like are ovulating that egg. What we do at a minimum 3 months beforehand affects, that quality of the egg. So I even say, let's push it 6 months prior.
Wow.
Yeah.
Right. So you got to like plan out like when you want to have this baby, right?
You want to, I mean, in a perfect world, I usually say give it 6 months. Like if you're known actively planning and you start, your prenatals and, we're looking at quality of diet, making sure that you've got your carb, protein, healthy fats, fiber, your gut health. We start looking at all of these things. We also then start getting some baseline blood work and assessing for any, nutrient status, low vitamin D, B12, optimal thyroid health, like all these different things that could affect, conceiving, pregnancy, and and I'm just summing those parts up quickly. And then during pregnancy, especially the first trimester, at a certain point it's survival mode, pending how you're feeling, and trying to get it, plenty of fluid, trying as best you can to get down those balanced meals, but also really listening to your body, because sometimes cravings also are our body's way of saying, like, we need more of this nutrient or this nutrient, and it manifests itself in a craving.
That makes sense.
Yeah.
That makes more sense than you just like randomly wanted pickles or something.
Right. Yeah. I was a pickle girl during my pregnancy. I'm not gonna lie. So I probably needed a little extra sodium, hey, there you go.
Right. But that makes sense. Like, okay, your body's telling you need sodium, and I know that there's sodium in this food item, right? Like,
yeah. Even like people like who are pregnant or not even pregnant, it could be anybody like craving ice. Ice, when you chew ice, it's like a sign of like iron deficiency, like you're craving ice. So long story short, there's a lot of different things, but we do really work, again, to optimize the diet as best we can, making sure that mom is eating enough, that your prenatal is really good quality, that we're also adding our omegas, like our DHA, which is fish oil during pregnancy. That's super important. And again, gut health, all the pieces. So we're making sure we're doing all of the work as best we can then, while still honoring the body's needs and, cravings. And, I say, if you're hungry, eat. You're growing a human being. So
Yeah.
you need to eat. And usually what happens, even, and this is where we sometimes not run into issues, but run into sometimes like depleted mom postpartum, is your body's going to prioritize the baby first over you. So I don't want to say you're going to be sucked dry, but like the baby is priority. And then whatever is kind of not left, but you're the second priority in your body's mind now.
Kind of like leftover. Yeah, you get the leftovers.
You're
just like
the leftover.
Just like when you're a toddler and you get their leftover or whatever they left on the plate.
It starts then and continues. Yeah, totally. And that's a lot of times too, when, if a mom maybe isn't eating optimally, or they're really nauseous and they're not able to tolerate foods, or, lo and behold, they're not able to absorb different nutrients, maybe because of a gut, issue with gut health or things like that, the mom then, you have the baby, and then the mom already, your energy's depleted, your hormones are whacked, all over the place. And now you're depleted, like even nutrient wise, you can go in very depleted. So postpartum, fourth trimester, I always tell moms, like, at least for like the first year, especially if you're breastfeeding, you have to take your prenatal, like take your prenatal at least for the full year, and don't stop, because we need to make sure that not only are you repleted, that you're not depleted, and we need to then work on that, plus make sure that you're good to go. So that's a super, super important piece of it. And then what we run into the most is then the exhaustion, the time, not having maybe the support to prepare meals, or the energy, or different things like that, So when I sit and I speak and do my fourth trimester support groups, I do speak about, we got to look at our core four. So that's our carb, protein, fat, and fiber. So that's what we want at each meal. We want to make sure those things are present. We definitely do not have to go and start cooking and making a whole meal and this and that. A lot of times we don't have the energy. So we start simple. So I'll say to moms, okay, like, which meal is the hardest, and then we break it down. So breakfast, how do you make a balanced breakfast that's quick? Plain yogurt, right? Protein. You do a quarter cup of a granola you like. There's your carb. Add your berries and flaxseed, chia seed, right, for some fiber, and some fat. You can maybe add even a little bit of like slivered nuts for a little more fat. There you go. You just you made a balanced breakfast in like under 2 minutes.
Yeah.
So
that's so important though, for like just even to know that, like, okay, like just make sure you have these 4 things. Like 4 is like a number I feel like is manageable.
Yeah, I coined it the core 4 just for ease of remembering. But yeah, and I know, and I have a 19-month-old, so it's still pretty fresh, the postpartum journey. But you're exhausted from not sleeping. Again, your hormones are trying to find their new normal. Maybe you're breastfeeding, maybe you're not, and there's a lot of things going on. So just making sure that you either have somebody that can help with cooking foods and providing, or that you have easy, simple balancing that you can grab that are very low prep.
Yeah. Do you have like favorites, like go-to favorites that are like easy for people to find in like a store or something?
For sure. Yeah. So that yogurt parfait, you could make, that's an easy, you can just like assemble it yourself kind of thing. I usually like to, if you do like oatmeal and you don't feel you have time to make it, there's pre-made cups. They actually look like yogurt cups, but they're oats. The brand Mush and the brand Brekkie are really good.
Oh, cool.
Yeah. And then all you do, usually I'll just like scoop mine out. I'll throw in berries and like chia and flaxseed in it and mix it up. Really
love chia and flax seeds. I just throw those into like everything. I feel like it's one of those things that like it can hurt and it adds so much value.
Exactly. Yes. Like great source of fiber, omega-3s, which are really good for decreasing inflammation and things like that. So too, you're trying to nourish and replenish yourself, and that does affect, how you're feeling, your energy levels, even if you're not sleeping, how your milk production, it does. If you are depleted, how is your body then supposed to produce, enough?
Right. And that was a struggle for me because, well, my son had ties, so he wasn't totally draining breast. So that was part of our issue, that I started to get a dip in my supply. And then it became like a fixation of, okay, well, I'm going to find recipes that are going to beef up my supply and I'd buy supplements that try to increase my supply. I feel like probably a lot of moms also have that, like, almost like, okay, well, I have to like stock up on something now, like I'm getting low, that almost like panic that you go into. Do you work with moms that have those issues? Like, do you recommend any sources or foods or something in general that help with that problem?
I mean, there are different supplements and stuff, like Fahrenheit is one of them. And I'll be honest, I don't really put a ton of weight in, to be honest with you, into like a magic like supplement or this or that, more or less than like adequate hydration, balanced nutrition, also hormone health, like, and moms too, if you're not drinking like plenty of water, like, oh my God, that's like, mixed coconut water, or like, they do have those lactation support, like teas and things like that. You can do that alongside water.
Oh, right,
You
right. You
know,
do the herbals too. Like, is there an herb that I remember drinking some sort of an herbal tea that in my mind was very helpful, um, more so than like any other like specific supplement I tried, but I don't remember what it was now.
was it like a combo blend of stuff,
Yeah,
or just
yeah,
one specific?
it was in like a tin. It was the gold lactation. She has like not gold lactation, gold something like liquid gold, I think it was called. And I forget the brand now. You totally forget everything once you're out of
Yeah,
that. So, I even have
it's
one in my office. I forgot. Then there's one with the blue bottle, and then
the
they had.
fenugreek is for the milk production. It probably had that in it, is what I'm gonna guess, as an herb. I'm gonna guess.
I know there was a controversy of like some were fenugreek free and some had like extra fenugreek. So I was like, all right, we'll just like see which ones work. But so
Yeah.
I don't remember what was in there, but I don't know, some sort of herb thing. And I remember someone told me to do like some sort of like a wheat thing. What was it? No, like barley or hop, something that you would like put into, I don't know, like a cookie. It was like some sort of like a round.
Yeah, I think it was hops. I'll be honest with you. I don't
You don't.
and I use herbs and stuff a lot. And I do think, the fenugreek is good. It's helpful, but it's definitely just not the one thing. You could do that in addition for sure, and make your lactation cookies. Brewer's yeast. That's what it was.
Brewer's yeast, yes,
Sorry,
brewer's
it just came to me again. Brewer's
yeah.
yeast.
But see, like, I wish I had someone like you being like, all right, like, instead of just like trying to find a quick fix, like, let's just look at what you're eating. Let's look at what you're drinking every day. Like, that seems like a much more like healthy approach and holistic approach, right?
Yeah. And again, the herbs you can use as a piece of it for sure, but adequate hydration is huge. Balanced meals. And also, like if your prolactin level, if there's maybe some kind of issue going on, there's a hormonal imbalance, there's a thyroid issue, prolactin isn't surging as much as it should. You're not making enough milk as a result. You know, stuff happens. If you have PCOS, sometimes that can even run you more of a risk of having difficulties with milk production due to those hormonal imbalances. So I feel so bad because moms, like, a lot of times, like, if it's not going perfectly or the way they wanted, they blame themselves, and they shouldn't. There's just so many things, but the good news is there's so many support too, working with a lactation consultant, working, with a dietitian, working with like a professional who knows about tongue ties, like if that's an issue, supporting yourself with all of the providers that you need.
Yeah. Yeah, I know. It's like that's the village, right? That like it's like where was that village? Oh, that's the village of the people that I need
Yes.
like cultivate them.
Yeah.
And then like you were just saying about the stress levels of moms and like, really just like it could be from difficulty with breastfeeding or just tiredness, or maybe like you said, they come out of the pregnancy already depleted sometimes. So by the time you see them, they're already like they've been zapped of like all of their like nutrients and strength. And that must play a role in their stress and how they like respond to the stress of just having a newborn and everything that goes with that. How do you help moms with that piece? That's hard.
So, you want to take a step back. It's individual for sure. And you do want to like look at the root causes of some of these things. One thing that's, first too, the second you have that baby, you're like estrogen, progesterone, they like drop abruptly. And it's so abrupt and acute. I mean, like you're feeling it, and that can trigger the depression, anxiety, the stress, especially that like low to drop in progesterone, and then, like we said, when you are sleep deprived at that baseline, like already, because sleep is one of those what I call one of the pieces. You're having issues usually then with like brain fog, and your energy is depleted. Your blood sugar levels are off. You might have more cravings, or different things. Your body's like craving sugar or carbs to get your energy up. It's like the quickest way to do it. So there's a lot of these things. Also, one thing that gets overlooked a lot, and if you take one thing out of this, listen to me for this. The thyroid health is very underlooked prior to, during, and postpartum, especially. So definitely, if we know going in that a mom has a thyroid issue, they're monitored. Some moms may need Synthroid prior to and during their pregnancy. Synthroid is a medication for thyroid. But what we don't catch a lot is the postpartum after. And it can be in a mom who maybe had healthy thyroid levels, or again, maybe you unknowingly went into your pregnancy with less than optimal thyroid levels. It's not something that's routinely checked unless they know you have a problem. So
that's so important. I actually did have my levels checked because I thought that was that was one of the other things I had researched, that thyroid issues can result in miscarriages and things like that. But I never thought, I thought, okay, well, it was fine before, so I just assumed it would be fine after. But that's really interesting to learn that, because your hormones change, your thyroid, you might not have a thyroid issue before, and you might have one after. That's big for people to know and get checked, right?
No, absolutely. And if you think about it, so we have thyroid supporting nutrients, things like iodine, selenium, vitamin A, and zinc. Well, guess what? Those are getting massively depleted and drained too during pregnancy. Your iodine requirements, your body's like at a certain point is also forgot which stage it is, but like your thyroid is actually also working overtime for your baby until like that pulls through. So now what could be happening too is we went in maybe depleted and we didn't even know it, right? Especially with some of those thyroid nutrients. We don't always think about those. You're getting texts throughout pregnancy, right? They're being utilized for you, for the baby, for everything. We're not replenishing them. And then by the end, now, you're missing those or depleted in those supporting nutrients for your thyroid. That leads to issues like hypothyroidism, even like, it could even be the other way, more like hyper or just altered thyroid function. And then what we see postpartum, and, sometimes it's suboptimal, like just a minimal suboptimal level, maybe you're super, if you're super exhausted, you're really like beyond measure. And it's sometimes hard to tell because we think it's fatigue, but sometimes, and I never bring weight up, but like if people are like, I absolutely like I cannot lose any of this weight, they're really depressed. They're having like a lot of the postpartum depression. They have got to get their thyroid checked. Got to, because that can be a root cause for all those things. And on the flip side, if you're noticing you're really wired, you're really anxious, you're having trouble sleeping, you feel like you're like bugged out, it could be hyperthyroid, meaning like your thyroid's actually kind of over functioning, and it can cause like even dramatic weight loss, like different things on the other end of the spectrum. And
Yeah,
it's
I
just something
that is not ever talked about. Like never in one doctor's appointment did anyone ever bring it up, tell me what the symptoms are to watch out for. Oh, if you experience these, you should get your thyroid checked. Or just even at the whatever month appointment, just asking me some of those questions just to say like, okay, well, I asked you, it sounds like you don't have any red flags for a thyroid issue. That's what I was checking. If you see X, Y, and Z, please go and see this person. But like that never even comes up.
No, it doesn't, and it's just, you get 1 6-week postpartum check-in and they're like, how are you doing? And you're like, well, I don't even know, like half the time, like it's just,
you're like, I don't know, I guess I'm okay.
Yeah, like, so, and it's super important because again, all of these things relate, because then, then you can get depression, all these things, and then it affect indirectly, all these things can affect milk production, they affect how you bond with your baby, they affect your just like as like a mother and your healing journey postpartum, so it's just making sure, you look at some of the root causes, and that you make sure you're trying to do the supportive work alongside it, and find yourself a good team of all different practitioners and people that, are there to support you and hold space for you. And so important.
So important. I know. In my ideal future that I see, it's just like this is just standard medical care at this point. But like, we're not there yet. But that's that's what I want it to be in my mind.
Yeah, no, I agree. And like, it's how it should be. And, when we talk about integrative medicine, it is like functional combined with conventional. It's looking at it, it's an integrative approach. It's not just one's better than the other, than this, than that. But, it's about how we're looking at it, and how, who's hearing you, who's paying attention. So all we can do is get the word out there, empower women. If you feel something is off, your own body better than anybody. Don't let anyone tell you otherwise. Trust your intuition, ask the questions. And if you're not satisfied, find somebody who will, help with whatever it is.
I know, and I feel like sometimes it almost works opposite in an effort to like that community of people. Sometimes people will ask a question like that, like, oh, is it normal to feel so tired? Right. And people might be like, oh my gosh, yes, I was so tired, without even, they might like almost downplay their concerns without meaning to, like without knowing what they're really doing, just trying to make them feel better and empathize and sympathize with them, but unknowingly like making them feel like, oh, okay, this must just be normal then. This must be normal. I'm fine. This is what everyone feels like. But it actually might not be,
No, it might not be. And again, coupled especially with other symptoms like we were talking about, and great, what, worst case scenario, you ask, they do the lab work, like a full thyroid panel, and you're fine. Great. At least we know that that's not what's causing it. And maybe then, yes, it is, you are sleep deprived, or we just need to like, you maybe are nutrient, depleted, and we just need to like focus on, that piece of it, but at least we then know too, that at least thyroid isn't playing a role. But if it is, we need to know, because we need to work on it then, and we need to support that.
Yeah,
function.
and it sounds like a finicky sort of an organ that it's like a little temperamental. Like it sounds like it's easy to upset it. Like it could be, oh, you have too much, oh, it's not enough, oh, like like it just
It's
seems
easily triggered. Yeah.
yeah, exactly. But luckily there's people like you out there to help new moms. I just, wish more people access that type of help. I wish it was just standard care, like I said. But every mom should have one of you as they go through their journey,
Aw.
checking in on them, being like, okay, like how was, this month or the last 2 months or something, just to make sure everything's like on track. Because like
Totally.
no one asks you that. Like, oh, are you eating enough protein? No one ever asked me that once, ever. Any doctor, I had been to a few and a midwife, no one ever asked me what types of foods I was eating, how much of fats versus proteins, was I eating too many carbs and not enough healthy fats? Like, no one ever checked, and they should
No.
have.
Yeah, it's overlooked. Nutrition's overlooked a lot, and thought of as kind of like, there's always this jump to meds or this jump to other pieces, but getting back down again to kind of like if you're thinking about the basics and the roots, like optimal nutrition, sleep, gut health, stress management, hormone health, all these things, when we start also fixing, you'll see, like if we even focus on just fixing one area, all the other things over the next couple months and things like they'll start to realign themselves because they're so interconnected. So
Well, that's a good thing about all the interconnectedness. You fix one thing, you also fix other things, right?
yes, yeah, it's a journey for sure, but yes, absolutely.
Amazing. Well, thank you so much. This was an amazing conversation. I hope so many moms, even if you've had a baby already, you might be thinking about having another one, have a friend or a relative who's pregnant or thinking about being pregnant, or, just any of those things. So hopefully this will be helpful. You can share it with them. And where can people find you if they want to work with you?
Yeah, absolutely. So our practice is Real You Nutrition. We're located in Wantagh. We also offer telehealth nutrition as well for people who are further away. We also participate in nutrition, listen to me, most insurance plans. So we do take a bunch of insurance plans. And our office number, if you are interested, it's 516-344-5542. And you can find us on Instagram as well. It's Real You Nutrition, all one word, _. And that's us. And please go ahead, follow us. We post a lot of good info. We talk about a lot of these things. We post a lot of good recipes, and you can always DM us for questions, or if you're interested in getting hormone testing, gut testing, like any of the things, let us know. We're here for you.
Amazing. That is so wonderful. Thank you so much. And it was so wonderful to hear all this really life-changing information. So I hope everyone got lots of value out of that. If you did, make sure you are liking and subscribing and sharing with friends so that more people find the help that they need. So thanks so much. We'll see you next time.
Thank you for listening to How to Unpicky Your Picky Eater. To learn more about achieving your child's feeding goals, check out Christine's website at foodologyfeeding.com. And be sure to tune in next time to How to Unpicky Your Picky Eater.